Welcome to another Medvarsity Deep Dive. Today, we're going to be diving into the world of apraxia. It's a neurological condition. And, it can really make you kind of rethink how our brains control movement. So our listeners have reached out wanting to understand apraxia a bit more. And we're going to break down a medical case discussion to help kind of shed some light on this. It's a fascinating condition.
Yeah, it's definitely a condition that challenges our understanding of the brain,
Yeah.
especially that link between intention and action.
Yeah, and it's almost counterintuitive in a way.
Hmm.
Because apraxia isn't about muscle weakness or paralysis. It's not that people with apraxia can't physically move. It's that the purposeful, intentional movements, those are the ones that become difficult. I'm already intrigued. So maybe let's just start with the basics. How would you define apraxia in simple terms?
Sure. So apraxia is a neurological condition that makes it hard to perform purposeful movements. Even though your muscles and coordination are fine, it's like your brain knows what it wants to do.
Yeah.
But it can't quite send the right signals to make it happen.
So it's like having the intention, but not the execution. Like you can picture in your mind, but your body just doesn't cooperate.
Exactly. And to make it even more complex, there are different types of apraxia, each affecting movement in a unique way. So for example, let's take verbal apraxia.
Verbal apraxia, so this affects speech.
Yes.
Yeah.
Imagine someone trying to stick their tongue out on command. They might struggle and fumble, but if you were to put some honey on their lip, they'll instinctively lick it off without a problem. It's the same action, but the intention changes everything.
Wow, that's a really powerful example of how intention plays such a critical role in apraxia. It really highlights that this is like a brain-based issue, not a muscular one. So I'm guessing this disconnect between automatic and intentional movement, that comes up in other types of apraxia too.
Absolutely. There are three main types that we can use to highlight this disconnect: motor apraxia, ideomotor apraxia, and ideational apraxia.
Okay, I'm ready to break these down. Let's really get into the specifics of each type. So let's imagine we ask someone to touch their head. How would that action look different in someone with motor apraxia versus ideomotor apraxia?
Great question. So with motor apraxia, the person would struggle to even initiate that movement. They might make clumsy attempts almost as if they've never touched their head before. The movement itself is uncoordinated and awkward.
Interesting. So it's not that they don't understand the instruction. It's like they can't access the motor program for that specific action.
Precisely. Now with ideomotor apraxia, they understand the concept of touching their head. And they can even describe how to do it. But the execution is off. They might touch their cheek or use the wrong hand, as if the message got scrambled somewhere along the way.
Okay, so with motor apraxia, it's a problem with initiating the movement. And with ideomotor apraxia, it's a problem with executing the movement correctly, even though the concept is understood.
You got it. Now, ideational apraxia takes this disconnect a step further. It affects the individual's understanding of the action itself. They might not even attempt to touch their head because they don't grasp the concept or the purpose of the action.
Wow, that's a much deeper level of impairment. So even basic actions become a challenge because the brain isn't processing the idea behind the action.
Exactly. And this understanding of the different types is incredibly important. For therapists working with individuals with apraxia, it's not a one-size-fits-all condition. Treatment needs to be tailored to the specific challenges each type presents.
That makes perfect sense.
Hmm.
And speaking of different types, I understand there are a couple more we haven't touched on yet. Constructional apraxia and dressing apraxia. What can you tell us about those?
Sure. Constructional apraxia affects spatial tasks, like drawing or building. Imagine asking someone to draw a house. They might know what a house looks like, but their drawing ends up as a jumbled mess of lines lacking spatial organization.
So it's not a problem with artistic ability, but rather a problem with spatial awareness and planning.
Exactly. And dressing apraxia, as the name suggests, makes it difficult for someone to dress themselves. They struggle with putting clothes on in the right order, buttoning, or even orienting the garment correctly. It often goes hand in hand with constructional apraxia because they both involve difficulties with spatial relationships.
It's fascinating how something we take for granted, like getting dressed, requires such complex brain processes. We've covered a lot of ground here. Verbal apraxia, motor apraxia, ideomotor apraxia, ideational apraxia. constructional apraxia and dressing apraxia. So much variety.
It really highlights how intricate the brain is and how much we still have to learn about its incredible complexity.
Absolutely. So for our listeners who are, say, therapists,
Yeah.
working with individuals with apraxia, why is understanding these different types so crucial? What difference does it make in a clinical setting?
Well, first and foremost, early diagnosis and intervention are key. The earlier therapy begins, the better the chances of recovery and regaining lost function.
Makes sense. It's all about harnessing the brain's plasticity, right?
Yeah.
The earlier you intervene, the more adaptable the brain is.
Precisely. And understanding the specific type of apraxia allows therapists to really tailor their approach and create a targeted treatment plan that addresses the individual's unique challenges.
So you wouldn't treat someone with verbal apraxia the same way you would treat someone with, say, constructional apraxia.
Exactly. Someone with verbal apraxia might work with a speech therapist to practice forming sounds and words, while someone with ideomotor apraxia might benefit from exercises that help them break down complex actions into smaller, more manageable steps.
And it seems like patience and understanding would be paramount for therapists working with individuals with apraxia.
Absolutely. It's crucial to remember that these individuals are not being lazy or uncooperative. They're grappling with the neurological condition that affects their ability to control movement. It's about finding ways to communicate and work with them that take their specific challenges into account.
And this can sometimes require thinking outside the box, right? I recall an example of using different types of stimuli to help patients who have difficulty with auditory comprehension.
That's a great example. Imagine working with someone who's had a stroke and is struggling with apraxia. If their auditory comprehension is impaired, giving them verbal instructions might not be effective.
Right. They might hear the words but not be able to process them
Mm-hmm.
and translate them into action.
Right, so instead of relying solely on auditory cues, therapists might incorporate visual stimuli like demonstrating the action, or even kinesthetic stimuli like physically guiding the patient's movements.
Almost like creating a new language for communication, one that bypasses those impaired pathways.
That's a great way to put it. It's about finding creative ways to connect with the patient and help them regain control over their movements. And it's incredibly rewarding to witness their progress as they gradually regain their independence.
This has been such an eye-opening deep dive into a condition I admit I knew very little about before. We've covered so much ground, but I have a feeling we've only just scratched the surface, haven't we?
Oh, absolutely. There's a whole universe of knowledge out there about apraxia, from the underlying neurological mechanisms to the different treatment approaches and the latest research on rehabilitation strategies.
It's amazing to think that something as seemingly simple as touching your head or getting dressed can involve such complex brain processes.
It really does make you appreciate the intricate workings of the brain, doesn't it? And how much we still have to discover about its incredible complexity.
I'm already thinking about all the questions I still have. But for now, I think we've given our listeners a solid foundation for understanding what apraxia is and why it matters, especially for those working in healthcare and therapy.
I agree. And I hope this sparks their curiosity to delve deeper into this fascinating area of neuroscience.
I know I'm definitely more curious than ever. And you know me, I always like to end our deep dives with something to ponder. So reflecting on everything we've learned about apraxia, what really struck me is how even those seemingly simple actions, like touching your head or sticking out your tongue, rely on such a sophisticated interplay of brain regions and processes. Yeah. It really makes you wonder, doesn't it? If something as simple as touching your head required all this coordination and intricate brain activity, what does that tell us about the more complex actions? Things like playing a musical instrument or dancing or writing, even just having a conversation. All these things we do without even thinking about it.
It really puts things into perspective, doesn't it? I mean, these seemingly effortless actions, they actually involve this like symphony of neural activity happening inside our heads every second of every day.
Yeah, and it makes you think about the incredible potential of the human brain. I mean, if we could unravel the mysteries of conditions like apraxia, imagine what other doors that might open, what other possibilities we might unlock.
That's a question worth pondering. It reminds us that there's always more to learn, more to discover about the human brain. And the more we understand, the better equipped we'll be to help those facing neurological challenges.
Well said. So to our listeners, we hope this deep dive into apraxia is giving you a new lens through which to view movement and intention, and the amazing capabilities of the human brain. Keep those brains buzzing, and we'll see you on our next deep dive.